What are some common misconceptions you've heard about maternal health or just women's health in general?
I mean, there's a lot of things, like racially, like people think that like Black women can handle harder labors. There's a misconception also about women who have a lot of babies, that some healthcare providers think that like, oh, like they'll be a fast birth, they won't need like extra care or anything like that.
I guess like a maternal misconception is a woman who have natural birth versus medicated birth, right? But it would be like unmedicated versus medicated. And I think especially like in Hispanic culture, if you have a natural birth, you kind of, in a sense, you're able to take the pain. So you're like more, you've gone through motherhood, and like the labor is kind of a symbol of like how strong you are, in a sense. The misconception is you aren't a woman enough.
Some common misconceptions I think usually surround like abortion care, and that a lot of people think that women are just kind of going around just getting abortions all willy-nilly, which I mean, fine if they are, but there are more, like it's more than just women who maybe have an unwanted pregnancy. Sometimes it's like to save their life because something's wrong with their baby, or it's just, again, kind of just coming down to their choice.
Okay, I think a common misconception to women's health is that women's health is not tied to the whole family's health. I think the health of the entire family unit is really influential to how a woman perceives her own health. The health of her partner, her children, her parents, whatever that family unit looks like, I think is connected to how a woman prioritizes her own health and thinks about health generally.
You're listening to Community Level, a podcast where public health research meets real-world impact. Brought to you by the Community Health Sciences Division of the University of Illinois Chicago School of Public Health. We bring you real conversations with researchers, practitioners, community leaders, and organizations working to create healthier communities. Now, let's dive into today's episode.
Welcome to Community Level. I'm your host, Pavani.
And I'm your co-host, Linda.
And today we're breaking down myths around childbirth and abortion care. And we're here with Dr. Connie Lu, an OB-GYN and a complex family planning fellow at UI Health. And we really appreciate you taking time out of your day to speak with us, Dr. Lu. So can you give us an introduction about yourself and tell us what inspired you to get involved in maternal health?
Yeah, of course. Thank you so much for having me on this podcast. So I have been interested in maternal health for a long time. Especially reproductive health care and abortion care specifically. I grew up in Indiana, and so growing up, I saw a lot of like anti-choice, anti-contraception rhetoric. In high school, I had classmates who would protest Planned Parenthood. I would see anti-choice billboards light up the highway. And so I definitely encountered some of those things early on. And that shaped a lot of my interest in the healthcare aspect of it when I went to medical school. And so I actually went to medical school knowing that I wanted to be an abortion provider. In college, I was really involved with feminism activism on campus, and found myself like at protests against the abortion bans that were happening in Indiana at that time. When I was at these rallies and at these protests, I found myself thinking, what else can I be doing to help ensure reproductive justice for everybody? And I realized at that time, with an interest in medicine and in healthcare, I realized that there was this space for being both a physician and an activist as well, and that I had the potential skills to be able to help people access, all forms of reproductive health care, from delivering a baby if that's what they want, to getting an abortion or getting an IUD even. And so when I went to medical school, I knew I wanted to be in that space. And then I ended up as an OB-GYN resident at Northwestern, and now a family planning fellow at UIC. Yeah, and so obviously I can talk about that for a long time, but I'm happy to tailor that to whatever questions you guys may have.
It's really amazing that you're able to kind of combine activism with your career path. And I especially liked how you mentioned that it's the person's choice and that you want to help them have the baby if that's what they want, or you want to give them an abortion if that's also what they want. And regarding, I guess, misconceptions, because I feel like when people think about family planning, they only think abortion care instead of the other side. So we posed a question to the students at the UIC School of Public Health around misconceptions around maternal health, and they had some interesting responses, including, I guess, natural births versus medicated births, and how sometimes if you're able to take the pain, it's seen as a symbol of how strong you are in some cultures. And another student talked about misconceptions about abortion care and women using abortions as contraception. And so what are your thoughts on what they said?
Yeah, so Pavni, you really you were able to really like get that concept that yes, absolutely, like family planning and reproductive health like exists on the spectrum, right? And so I really believe that as someone who works on L&D, the babies that I deliver on L&D, those people are making like family planning choices for themselves in the same way that someone who has never been pregnant comes to my clinic and chooses to get a Nexplanon or IUD or nothing, right? And so all of those are choices, and all of those are things that we should have access to be able to have autonomy and control over our own bodies, which is what we should all aspire to in healthcare and in medicine. Some of those myths and misconceptions that you brought up are really common and things that I hear about from not only my patients, but from my friends and from, people in the community, especially from social media these days. And so I think it's really a good thing to address. In terms of kind of the idea of pain being a symbol of strength, pregnancy and childbirth, no matter how one accomplishes those things, those are really, really, really hard things to go through, and really potentially beautiful, but also potentially dangerous things to put one's body through, right? And so I take pregnancy and childbirth very, very seriously. And I think no matter how someone experiences it, whether or not that's to go unmedicated, so without an epidural or without extra medications, or whether or not that's to go to get an epidural, right? I don't really think of one's experience of pain as a marker of their like success or their strength. And I think going through like 40 weeks of growing and carrying a living being inside of you is a marker of strength on its own, right? And so I think that is one of the things that we see in obstetrics and in maternal health a lot. We see a lot of value being placed on individual choices, right? Oh, if you choose to try this without an epidural, that means like you're a stronger person, or you're doing this in a better way versus someone who didn't choose that, right? And I think that can place a lot of like potentially harmful, what's the word I'm looking for? Potentially like harmful pressures on people to experience birth the right way. And there really is no right way. And I think it really ultimately is kind of what you want your experience to look like. And I think that's really important for me to prioritize as like the OB-GYN in that room, right? Everyone wants different things. There are people who want as little intervention as possible, and there are people who like get into the labor and delivery room and they're like, I'm ready for my epidural. And neither of those things are bad as long as we're still like understanding and prioritizing like safety of the patient, the pregnancy, the family, all of those things. And so, yeah, I think choice is a huge like theme that underlies all of these conversations. In terms of your what you brought up with abortion care, there are so many myths around abortion care, right? That we could spend a whole podcast episode debunking. And a huge part of that is, yeah, like I'm okay. Like a lot of people may say, I'm pro-choice. Like I think, someone could have an abortion once, right? Like that's their like, oops, I made a mistake. Like I'm going to get an abortion. And we know that there's a lot of stigma around people who have had multiple abortions, or even this idea of like, I'm okay with abortion, but it shouldn't be used as birth control, right? We've heard that. And the reality is, we are all really like complex individuals, right? We all have reasons and nuances for why we end up where we end up and why we choose the decisions that we choose. And those nuances, those complexities are unable to be presented in like thoroughly or comprehensively on this like bigger level, right? And so someone who may have had multiple abortions, or someone who has multiple abortions but doesn't want to use birth control, we don't know their whole story and we don't know their whole lives. They may have many medical conditions that make it so, an abortion is actually safer than being on birth control from their perspective, right? They may have tried multiple birth control methods that they don't like, and so then they choose to get abortion instead. Ultimately, what I know is that abortion is really, really safe. It's really, really common. And just because someone's had 2, 3, 4 abortions in the past, it doesn't mean that they are choosing unsafe options for themselves. And in the end, right, it's someone's body. I'm not going to tell them what to do with their body. And so I think those are the most important things to remember when we're talking about abortion, and understanding that people always have reasons for what they do. And oftentimes when we take the time to listen to what those reasons are, we can understand their choices a lot more. And I think that often is what is being lost when we talk about kind of these generalizable statements.
That was very well said. And I especially liked how you were able to, I guess, organize your thoughts like that, because there's so many times when I feel that way, but I'm not sure how to explain it. And so I really love how you describe that as well.
Thank you.
And thank you. And just talking a little bit about stigma, as a doula myself, I do see firsthand how cultural beliefs guide, what women think about pregnancy and what pregnancy should look like. Some clients feel pressured, to stay strong and independent. And so just wanted to pivot to the next question. How do cultural beliefs and stigma shape how women experience pregnancy and birth?
That's a really amazing question, Linda, and a really, I think one that deserves a lot of time and dissection. And it goes beyond childbirth, right? It goes beyond childbirth. It's also how we experience expectations around being women in our society, right? Mm-hmm. There's all these things about what we should do and how we should behave and how we should feel. And all of those things extend to pregnancy, it extends to childbirth, it extends to motherhood, right? And we ask these things of women, and I say women because, that encompasses most of the people that we see. These things extend to women so much more than it ever does for fatherhood, right? And in many ways, we don't talk about fatherhood or father's experiences in pregnancy and childbirth and all of that enough. And so I think you're absolutely right. A lot of these like societal expectations and cultural norms around femininity and motherhood end up seeping into the medical space, right? And so oftentimes I think as OB-GYNs, we tend to want to like medicalize it even more and make it like objective. And there are benefits to that, right? Because like I said, pregnancy and childbirth can be really dangerous. But I think we have to understand that that's not where everyone is coming from. And I think to contrast it from other things, right? Like people don't like go to a lot of their like medical procedures or whatever with all of these expectations and cultural expectations around it. People come into pregnancy and into childbirth with a lot of those expectations. Like they have plans, right? They have ideals. They have like, this is what I want to happen. And unfortunately, like that doesn't always end up panning out that way, right? And so I see like cultural expectations really playing a huge role in kind of creating this idea of the perfect childbirth, right? And the perfect delivery and all of those things. And it's not always a bad thing. I think it's great when everything goes perfectly, but I think it can sometimes be really disappointing for people when it doesn't happen that way. And it can make new parents feel like less than when their expectations aren't met. And yeah, I'm happy to talk about that more, Linda. I don't know if I fully captured your question, or if you had any thoughts about that.
No, I definitely think you captured everything. And so this rolls great into the next question. How do you approach cultural responsive prenatal care, especially for Black and Brown birthing people?
Yeah, and so I think another part of maybe to continue from your last question a little bit more too is, I think as an OB-GYN, I think when I'm meeting with somebody who, oftentimes the medical model, I'm not like seeing the same person throughout their prenatal care and then I deliver their baby, right? And so sometimes when I'm meeting someone on labor and delivery, I may not know exactly like culturally, where they're coming from and what their expectations are. And I think sometimes, especially Linda, since you're a doula or since you've been a doula in the past, you've probably noticed that there can be this like tension that exists, right? Between what the OB-GYN wants and what the patient wants and what their support people want. And I try to frame it like that tension doesn't have to exist, right? Our goals and our desires don't have to be at odds with each other. And in fact, they shouldn't. And so I think a big difference in obstetric care and in caring for someone in childbirth is we really need to emphasize that like collaborative aspect of it. I'm working with you, right? I'm meeting you here for the first time, but let's work together to make sure that I'm helping you achieve what you want as safely as possible. And I think that is a really important thing to remember, especially when childbirth doesn't go the way that patients want. And it's the best way to keep people safe, but also like happy and supported and empowered. And so I think that like connects to prenatal care too, right? And I think especially for Black and Brown people who are facing much higher rates of maternal morbidity and mortality compared to white women, I think it's really important that we think about what are we doing? How are we like failing our patients as a healthcare system, right? And you're exactly right. It extends far beyond their labor and delivery experience when they're delivering their babies, right? It goes to prenatal care, preconception care, postpartum care, all of those things are really, really important to ensure that we are caring for our patients' whole health rather than just their like delivery. And so I think it definitely starts in the prenatal period. It starts with building trust, right? Like, even if you may not be from the same community, may not speak the same language, like, we can transcend those boundaries and still build trust with each other and with our patients. And I think that trust creates a sense of safety, which is really important from the patient perspective, right? I've seen a lot of patients who are Black or brown who say to me, I'm really scared of dying because I see the news and I see like that I'm more likely to die because of my skin color. And that makes me really, really sad, but I totally, I get why they feel that way, right? And so we have to create a trusting relationship and build this sense of safety. And we also have to work with our colleagues to make sure that it's not just me as an individual doctor, right? But my colleagues, my nursing colleagues, the hospital itself. And that takes a lot more work, right? Like, I can change how I behave as an individual, but working to disrupt the system requires more, and we should absolutely be working to do that. I think as much as possible, we should be encouraging more like race concordant providers because we know that that's important when it comes to building those trusting relationships. And so I think as a physician, it's important to consider like, how do we increase like the diversity of our obstetric workforce? How can we increase that in different fields and specialties, right? So not just as OB-GYNs, but as midwives, as doulas, as other birth support people. I think that's also really important because ultimately, to kind of help our patients feel safe, I think we need to amplify their voices, and we also need to increase the number of people around who can help amplify their voices. So I think those are baby steps, but those baby steps can make a big difference, especially when tackling like, really big systems that need to change, like structural racism and our unfortunately very very unequal, inequitable healthcare system.
All right. Well, thank you so much. So we're going to ask another question. What systemic changes are most urgent? I think you kind of answered that. Most urgent to close the racial gap in birth outcomes, such as the fact that Black women are still 3 to 4 times more likely to die during childbirth.
Yeah, that's a huge question. And I think if there was an easy solution, I would hope that would have, been already attempted. And so I think there's a lot that happens in the disparities that we see, right? And we know that for such a wealthy country, the United States, the maternal morbidity and mortality rate in this country is not what it should be. And a lot of that comes from health inequity and structural racism, right? And so I think a lot of it also stems from how capitalist our healthcare system is, right? Is even in Chicago, we see maternity deserts, we see maternity healthcare providers, labor and delivery units closing because their hospitals have decided that it's not profitable enough. And we know that having less access to good healthcare increases morbidity and mortality, right? And so when we look at why people are dying from their pregnancies and from their childbirth, we know that a lot of the causes tend to be preventable, such as hemorrhage, cardiovascular issues, thrombotic events like having clots in your legs and in your lungs. And a lot of those things can be treated if someone gets seen, gets evaluated appropriately, and then gets the treatment, right? And so if so many of these things can be preventable, we should be doing those things to prevent them. But then when you think about it, when I laid out, okay, what can prevent those deaths, you can see how there are so many moments where someone could not get the care that they need, right? If they're home and they're bleeding, but they maybe they weren't like appropriately counseled on the precautions to look out for. That's step number one. And maybe they didn't know that their bleeding pattern isn't really normal and that they should call their healthcare provider about it, right? And so ensuring that people have good education and good health literacy is really, really important. And sadly, we don't have good health literacy in this country. Number two, if they feel like their bleeding is abnormal, how do they contact a provider? Do they know who to contact? Do they have somewhere close by that they could go to? Right? And then, as we know, like the access to hospitals, to OB-GYNs vastly changes based on where you live and what your zip code is. And then once they are in a hospital, how do we make sure that their concerns are being heard and being evaluated appropriately, and that they're not experiencing microaggressions and maybe more subtle components of structural racism that makes it so their voices are not, or their concerns are not being taken seriously, right? And then lastly, what's the quality of the hospital that they're in? Are they going to get the right testing? Are they going to get the right sorts of treatment? And all of those things can really affect how someone is able to survive a potentially dangerous condition. And so I think a huge part of this, right, is that we just have such healthcare inequity in our country that even within one city, the hospital that you end up in can change, right? Like how your medical experiences or your like likelihood of survival, that should not happen. And so that's why this question becomes so big and why it can feel really hard to answer, because it's not just about OB-GYN, right? It's not just about maternal health. It's about all of these other things that go into making our healthcare system money and profit driven rather than patient-centered.
Also very well articulated. I do feel like when people say systemic changes, they think we're talking about just the healthcare system, which does need to change, but there's also a lot of other things that need to change as well. And I do like how you mentioned some patients not being taken seriously. And I was wondering what your thoughts are on, and Linda, I would love to hear your thoughts on this as well. How can birthing people better advocate for themselves during labor and delivery? And what does informed consent actually look like during childbirth?
Yeah, and I have a lot of feelings around like medical information being disseminated on like outlets like social media and TikTok, etc. But I do think one of the benefits is that it gives more knowledge and education to patients, right? And so while I think there's a lot of mis and disinformation on social media, and we really should be like trying to get our information from like reputable sources, I do think what I've seen is like patients are like asking me things, right? Like they're saying like, hey, I saw this on TikTok. Can you talk to me more about it? And so I think it's really important to give our patients like the information that they deserve to know about their own bodies and their own healthcare. And so I would love if everyone knew how the reproductive system worked, right? What their anatomy looks like. Those are all really, really important things. I think on the flip side, though, is we're seeing a lot of not so real or true information being spread on those outlets. And we're seeing a lot of that being absorbed by people, right, who then unfortunately are in very real situations where they have a lot of medical distrust or healthcare distrust. And so then they don't follow like recommendations of doctors or providers or things like that. And so I think there are pluses and minuses, but overall, people should absolutely like have more education about what is happening to their bodies. I say that though with that asterisk, right? Because I think especially in the age of RFK and the MAHA movement, like we need to be really discerning about the information that we're absorbing and the information that our patients are consuming. And so I think education is number one. I think number two is, I always want my patients to feel empowered to be able to ask me questions, to be able to talk to me like truthfully about their concerns. But I understand that a lot of times those environments are not that safe. And so I think people can only speak up if they feel like speaking up isn't going to lead to like other potentially negative consequences, right? I think I've heard of people who are like, oh, I said this thing and then it completely changed like my relationship, or I felt like they treated me differently, or those types of things. And those we don't want that to happen. So I think continuing to train clinicians and providers to be patient-centered, to also center like patient voices, right, in their conversations is really, really important as well. Pavani, can you ask your question again? I think I forgot what your question was.
I think you answered it very well, but how can birthing people better advocate for themselves during labor and delivery?
Yeah. And I think another thing is like, not just like, it's hard to advocate for yourself when you're in pain and you're, going through labor and things are happening really, really fast. And so I think it's good to also have people with you who are there to support you too. And that's why, doulas are really, really helpful. Having partners who are invested and engaged is really, really helpful. And I also think like having a sense of what, starting that process before you're on labor and delivery can be helpful as well. So people like creating birth plans and those types of things. And I think, or even starting those conversations with your OB-GYN in clinic before you're admitted to the hospital, right? Because I think what I hear a lot of people say is like, oh, it all just happened really fast, or it was so overwhelming that people aren't really, aren't as organized or aren't as ready to kind of speak up for themselves in those moments. So yeah, I think those are important things. I think, sometimes I feel like I see a patient on L&D and they feel like it's their responsibility to advocate for themselves, right? I want to caution against that though, because in an ideal world, a patient shouldn't have to advocate for themselves to get respectful healthcare that centers their desires and their wishes, right? Like you shouldn't have to ask your doctor, hey, can you please listen to me? I would hope that when I walk into a room, I am allowing those things to happen. But again, I say that because, I know that that's what I try to do, but I also know that there's a huge variety in the providers that people can encounter. And so I understand why it may be important for people to feel like they are advocating for themselves. But I think it's important to present this not as like the doctor is like a patient's adversary, right? That we are working together. And their goals are also my goals.
Yeah, that was great. Like I agree with like everything that you're saying. As a doula myself, I try to teach my clients that, their voice matters just as much as that provider in the room. Advocacy starts with just understanding that nothing should be done to their body without clear, informed consent. For example, some of my clients have to make decisions right there on the spot. And before that, I give them this tool that's called Brain, where they can discuss it with their provider. And what Brain means is, what are my benefits for this procedure? What are the risks? What are my alternatives? How am I feeling? Like what are my intuitions? And what if I say no? And so this starts a whole conversation around, hey, is this for me? For example, a lot of providers like to do inductions at a certain week. And so I give them this acronym and have them to talk with their doctor about it. And a lot of them are very pleased after this conversation. So
Yeah,
thank you.
I really like that acronym as well, Linda. And I think that acronym, you laid it out, like that's how we give informed consent, right? And so I agree, sometimes when providers are a little bit more paternalistic and when they think like, no, I'm telling you to do something, so you should do it, then they may not go through all of those separate components that you just laid out, right? But that is how you give informed consent, is you go through the benefits, the risks, the alternatives, why we recommend what we recommend, and what would happen if you don't do it, right? And so I think like, yeah, you're exactly right. Those are things that we should be talking about. And sometimes, maybe when we've counseled on hundreds and hundreds and hundreds of inductions, maybe we like forget some of those things sometimes. But you're exactly right. And I'm glad you're giving that tool to people so they're able to advocate for themselves if they don't feel like they've had that conversation with providers. In general, though, I would hope that the majority of providers, if not all, are going through those things when talking about any sort of intervention, because that is what we should be doing.
I love the acronym, Linda, BRAIN. And it's not just maternal health, it can be used for any other procedure and hopefully everything you get in a doctor's office. And now that we're talking about just kind of ideals, what does reproductive freedom mean to you?
Yeah, reproductive freedom, I think, harkens back to the term reproductive justice, right? The ability for anyone with a body to make decisions for themselves and for their bodies. I think specifically within reproductive health care and people with reproductive potential, for people to choose when they want to start a family, if they want to start a family, for people to choose like how to parent their families, right, in safe and expansive environments, and for people to choose not to continue a pregnancy if they don't want to continue a pregnancy. I think, like we talked about from the very, very beginning, this is all a spectrum, right? And pregnancy, I like to talk about, is it's a spectrum. And so I am really, really grateful to be in an environment where I can provide all of those choices at every single moment of a pregnancy, to be able to help somebody enact their own reproductive freedom and reproductive justice. Because things shouldn't be happening to our bodies without our wish and without our consent, right? And so I think that's what reproductive freedom means to me. And I feel really, really lucky, especially in this current political climate, that we live in a space and that I work in a space where I am able to provide those options for people who come to see me in clinic.
Yep. And especially in this climate, people are very lucky to have providers like you who are willing and who know that the patient has choices and who make sure that the patient gives informed consent. And thank you so much, Dr. Lu and Linda, for your insights on this important topic. And we appreciate your willingness to share your knowledge with our podcast and our listeners.
Thank you for having us. Bye.
Bye.
Thank you for tuning in to Community Level. If you enjoyed today's episode, please don't forget to subscribe, leave a review, and share it with others. Join us next time as we continue to explore the intersection of research and community action. Until then, stay connected and stay level-headed.
You know what, I'll do the spiel later.